Thank you. Welcome to
Welcome, Sukanya.
Yes, thank you. Welcome to all participants. My heartfelt thanks to Dr. Lemu, Dr. Takahashi, Dr. Mishra for a wonderful vision of really encouraging all of us to think about how we can do this particular summit. Anyway, what I would request the organizer to do is to share my slides later on, because I just put too much. So I'm going to kind of touch upon the main points. And I also wanted to acknowledge I am part of Suffolk University, and my lab is known as Heart Lab, where students are working with me on this particular project on aging. So I want to acknowledge them too. So my talk will be very much the need to focus on elderly, or we call it here seniors, to respect the aged people. And then the theories and recent literature on barriers and healthcare need. Next is the models of healthcare services all around the world. And then finally, I want to introduce the project that I'm doing, and I have collected pilot data looking at use of mobile app and integrated healthcare system to facilitate aging care. So I'm not going to bore the audience with all the theories. I think most of you know that. I think Dr. Mishra talked about heredity and environment. Aging is beautiful when there is a lot of support. It has been already established by many psychological theories. And then I also wanted to show you some of the literature. I just compiled quite a lot that globally elder care, healthcare challenges are present. There is a rising need for healthcare across the globe for all aging people, partly because the aging population is growing worldwide, India, Japan, USA, and also in Africa. I'm so glad to hear Africa is leading in many ways such a beautiful initiative. And mental health also is becoming a need for all aging population today. And then also, after COVID-19, I can't speak for other countries, but in USA, the aging population is suffering because they are the neglected one. Just like, we talked about how we should respect, but after COVID, a lot of complications here in the physical and mental health care of aging. However, when we look at the healthcare facilities, there is a big gap. And I would say that USA is way behind in compared to other countries, because here, people, young people are more respected than elderly. And part of the reason I work with the community to do a little bit of my contribution to aging population. So studies have shown what are the success factors. Success for aging definitely refers to how much community engagement they have, our practices, healthcare practices, and also looking at how particularly the healthcare system is culturally responsive and responsible. Barriers include the digital literacy. I think somebody mentioned before, it's not about digital literacy. It's like coaching them, helping them. Just technological innovation cannot help our elderly and seniors. How are we making those technological devices elderly friendly? And also the regulation of policies, at least in USA, it's a disaster. With all honesty, I have to say, healthcare for elderly is not a very good thing right now due to many restrictions. So there is a real need, how the community coming together to help our elderly. I am not going to really go through all the literature, but I have the slides. Dr. Lemu, if you don't mind sharing after my presentation. Tons of studies have been done, including myself. A lot of our Asian population in USA are suffering because of many reasons, including pandemic, cultural stigma, family disturbance, neglect, abuse. Elderly abuse is here, both at home and also in elderly care services, because the providers are not really well trained. Besides their physical care, the mental health care of elderly is not appropriate, which is a shame because, we all will age, but that's not the focus in many healthcare systems here. And thus, mental health, particularly among Asians, that's my focus today in the talk, is really concerning. A lot of Asians after pandemic have suffered from many types of mental disorders like depression, trauma, and anxiety, lots of things. Thus, how are we going to look at what are the specific challenges? Physical health, anxiety, loneliness, relationship disturbances, and then financial issues, reduced engagement with elderly, the living situation, and then particularly Asian immigrants in this country do not have adequate support because children are far away from them. Even though they're in US, they don't live with them. So loneliness is growing. And also their feeling of not being productive because they are retired or they are not really feeling productive, unlike in many countries where we revere and support and respect elderly. Here, the scenario is a little bit concerning. Thus, when I look at, my research is looking at healthcare models, and what I found, there are a couple of countries who have used some model which is integrated one, and our Dr. Mishra is in Netherlands. So in Italy and Netherlands, studies have shown they have used a relatively community-based model. So as in Ghana, thanks to the Ghanaians, if anyone is here from Ghana, they are doing a little bit better, and also in Hong Kong. Said that, what I did is that I really wanted to look at, we are in a technologically advanced country. However, what can we do innovation-wise and so that our elderly will be more beneficial? And what we understand these days, most of our elderly, both here, I mean, talking about Asians here, there need to be kind of a focus how to redesign our mobile devices to make elderly friendly or friendly towards aging population. So what I did in my research, I took a project for last 2 years, and this is an exploratory study. I wanted to look at what are the needs, barriers given to us as a researcher from caregivers, users, and providers. So this was a project I started in 2021 after pandemic, because I work with the elderly community here. So my students and I are trying to focus on what could be done. What are the innovation we could introduce using mobile apps to facilitate healthcare and reduce barriers? So I did the pilot study in USA on elderly population, as well as collected data in Odisha, India on elderly. As I said, we collected from 3 sources: caregivers of elderly users, and their providers, which includes mostly physicians, but less psychologists. So I'm just going to give you now some information, what we found. What was very interesting, this is a mobile app, and it is dedicated to my father-in-law, and it's called Nimai app. Actually, I wanted to honor him who passed away to dedicate this app. And when we collected pilot data, I didn't want to go through all detail. This is what we found the themes using narrative analysis. The providers, caregivers, and elderly Asians in USA and India indicated that the needs and challenges were their memory loss. I think a participant asked Dr. Misra, which is very much true, accessibility to services, need for family and social connections, communication, transportation, loneliness, reduced family interaction and care, and then engagement in meaningful and spiritual practices, particularly Indian elderly said that, engagement in many community events and cultural events help to access ethnic food. And that's, again, Asians, Indians, many Asians in USA, they really long to have some kind of gathering to have food. And then the psychological stress and reduction strategy. So what we did, we tried to develop now certain features in the app in collaboration with a couple of IT developers, how to use those kind of features in the app. And what we did is that we really are trying to see how we could make it user-friendly. For example, friendly features such as logos, images across gender and education. For example, not many people are very comfortable with digital literacy. Can we use more images so that they click on the image, not read the text? And then we need to have some of the medicine and also connection with the healthcare providers, reminder of their exercise, their food, nutrition, and also how best to connect them with family and community members using the app, and then include some of the areas of entertainment. For example, can we have an app that a person could click if they are from a specific culture to use lesson music, to watch some of the films and videos? So this is in progress right now. And thus, my aim is to really make sure that our elderlies, particularly elderlies in this country, are really not feeling alone and rootless. I think root is very important to all of us. And not having that connection, many mental disorders is happening. And I just wanted to show you two pictures before I end my talk so that you will see this is what we are developing. This app is called Nimai Care. As I said, it's dedicated to my father-in-law, where they will have features, and this is under progress, so that they will have different images to click on. Their medicine reminder, appointment reminder. If they need transportation, there will be a picture of a transport, a car or the cab. And then how do we include all kinds of events there? Let's say someone wants to go to a religious event far away, which they need transport. There could be someone in the community could bring them to the event so that they can have all the schedule. So to facilitate, and also what many elderly, both here and in India, told us that the text are really small font. They want picture and big font because they can't see properly. And second, what I am doing here, my students who are undergraduates, I put them in elderly care facilities to talk to the elderly, to hear their stories, their life journey, because they are sources of a lot of experience and knowledge. So my students go out every semester to help elderly learn different things, including how to use mobile app, etc. So this is a little bit of my initiative here, which is not much. With the limited funding that we had, I tried to do that, but my pilot data has been collected now, and now I will be taking it to the next stage. That said, I know the time is very, very less. I want people to ask questions than me talking because it's a summit. And I really wanted to thank you. And Nigeria, thank you. I think Dr. Limu is in Nigeria. And namaste.